Welcome to this special virtual town hall discussion by Bickford Senior Living. My name is Melissa Smith, and I am the facilitator for this discussion and this question and answer session today about all things coronavirus vaccine. Now, you're probably wondering, what all are you going to cover today? Well, here's what we're going to cover today. We are going to answer questions that you may have about the vaccine and its distribution to seniors in general, and also those seniors that are moving into Bickford Senior Living. We're going to provide you with a timeline for the vaccine distribution at all of the Bickford locations in your area. And for those of you who are hoping to move into Bickford in time to receive this vaccine, we're going to share with you the necessary steps to take so that that might be able to happen by the vaccine deadline. And you're going to be surprised at just how easy this whole process is going to be. So it's really so exciting. I think it's personally very comforting to know that we in fact have a vaccine finally in 2021, and that in fact the seniors in senior living are the ones to receive this vaccine first. Because just to remind us all, there have been more than 20 million Americans who have contracted COVID-19 since all of this happened last year. The death statistics for seniors over 65 has just been staggering, and it's heartbreaking, if you will. This vaccine is in fact the game changer for us to be able to get a grip on COVID-19 for sure. Now, Bickford Senior Living, they were super proactive. They entered what's called the federal COVID-19 vaccination program, and it's why Bickford now has access to this vaccine, which is very exciting. We have some dates in January. I think we have one in February coming up, and we're going to share that information here with you so that you can see, in fact, how all of this is going to take shape. So there are the dates right there in front of you. We're going to show you this again a little bit later, but we are going to take you back for just a minute, just to reiterate the fact that this is, we feel obligated. We feel obligated to share this information with you because we want seniors who've thought about making a move to Bickford. We want you to know that if you've held back because of COVID-19, that making a move before the deadline, you will receive the vaccine. Those over 65 who have not made a move into a senior living community yet, those folks are not going to receive that vaccine until later in the spring. And then of course, for the rest of us, it's going to be 2022 before all of that happens. So again, here are the move-in deadlines for the Bickford communities in your area. For clarity, I think it's really important to note that that term deadline, that date that you're seeing there, that doesn't mean you have to be moved in completely. That is a signed document saying that you have taken possession of an apartment. That's what we have to have by that deadline. And we're going to explain those details to you a little bit later in this presentation. So take note of the branches that you're interested in. Take note of that move-in deadline right there on your screen. And then we're going to go back to this slide in a few minutes to get more details about what it means to take possession of an apartment in order to take advantage of receiving the vaccine through Bickford Senior Living. So don't worry if you didn't get all of that information down. Okay, so for now, let's go ahead and get some of those basic questions answered. Some of those commonly asked questions about the vaccine. And to do that, we have two of Bickford's executives who are joining us. First, we have Ann Cheverton. Ann is the Senior Vice President of Resident Services. Hey, Ann, thanks for being with us this morning.
Nice to be here. Thank you.
Great. And then we also have Alan Fairbanks, and Alan is the Executive Vice President of Operations. Alan, thanks for being with us.
Oh, you bet. Absolutely. Thanks for having us. Appreciate the opportunity.
Of course. So I think the very first question we want to get to in terms of these basic questions kind of out of the way is, which vaccine is Bickford administering to their residents, to their Bickford family members, the caregivers and such? And then how many doses does this vaccine require? And I'll turn it over to you guys.
Yeah, thanks for that, Melissa. So initially, we have partnered with Walgreens to conduct clinics in all of our locations. And the initial vaccine is Pfizer. In the majority of our states and locations, that will be the vaccine. There may be, as most of us know, there's some Moderna's been approved, and there's an opportunity that it could be that that gets utilized later on. But what we do know is this: whatever vaccine is utilized, that will be the vaccine that is consistently utilized in that branch and in that clinic. And there will be 2 doses that are administered. They are generally going to be 28 days apart. So what we've been experiencing is when Walgreens has scheduled our initial clinic date, they've also scheduled a second date, in addition a third date, to be able to potentially pick up any individuals that have moved in after that initial clinic has taken place. So the trials have indicated that to be most effective, and we've seen 94% plus effective rates with the vaccine, you must take both vaccines, both doses, not just one dose. So it's 2 doses and typically 28 days apart. And the clinics are being conducted by Walgreens, usually Pfizer, could be Moderna, depending on each individual state and that local Walgreens location.
So to follow up with that, Alan, will the folks from Walgreens then come to the community to do that, or will the residents have to go to Walgreens?
No, they'll come to the community. Walgreens will come conduct clinics in our locations. They will come with their own personnel, and certainly Bickford will have personnel to support that as well, from an RN perspective, from a leadership director perspective. So there will be Bickford personnel there as well. So we'll have you covered from Walgreens personnel, and Bickford's personnel. Will be plenty of people there to hold your hand throughout the entire process.
Fantastic. So Ann, this is probably for you. So why would you say, as a health professional, why should seniors get the vaccine now as opposed to waiting until the spring, when I believe is when those who are 75 and older will have access to the vaccine? Why do this right now? And are seniors more at risk if they don't get the vaccine now?
Yeah, I think that's a great point. We know already, the data has shown us that our seniors today are more at risk than the general population, especially those over 75, which is the majority of our residents at Bickford Senior Living. And the death outcomes are very, very high with this particular group. So it is really a life-saving vaccination. It's going to prevent the infection and really prevent those bad outcomes that we see more with residents that have other comorbidities, other diseases that already weaken them coming into an infection. So the risk is much higher by age, by disease type as well. It's very, very important they get the vaccine, so then they're protected.
Mm-hmm. Very good. A lot of people I've heard just in the general public, they talk about how quickly these vaccines were produced, and there is a little bit of worry around that. They were produced quickly, they were approved quickly. Do we need to worry about that?
That's another concern we've seen really in the internet as well. All of these different questions about, is it safe? These vaccines have been produced very quickly because there was a great collaboration between multiple countries, governments releasing funds, the private sector, pharmaceuticals really jumping in. Some of these vaccines have already been in place with coronavirus. This is a different version of it. So they have these mRNA vaccines already kind of ready to go for regular coronavirus. So just trying to modify them to be ready for this, be mass produced, was done very quickly. No step in the process of the approval of FDA was missed. They go through very stringent guidelines and review. And we know today that at least 3,000 participants have to take the vaccine for it to approve from a phase 3 to a phase 4 clinical trial. We've had over 50,000 people have received the vaccine in that trial setting. And today, we also have seen over 4 million people have been vaccinated as well in our country. So we know that the vaccines are safe. We know the side effects are fairly minimal, and people are doing well with these vaccines.
You mentioned these side effects. Let's talk a little bit about what some of those side effects are.
Most of the side effects are very similar to taking any kind of flu shot that most of our residents take during the flu season. You might get a little bit of soreness at the site where you had the injection. We've done several clinics already, and we're seeing very, very minor pain at the site. But more typically, as your body starts to build up some immunity to the vaccine, you might have that initial reaction of maybe a headache, maybe a slight fever, maybe some body aches. These normally last for no more than a day or so, and you can recover from those very, very quickly. As long as people can take some Tylenol or Advil, or certainly take some fluids, make sure they have plenty of rest. We do know the second dose of the vaccine sometimes has more side effects. And so again, just making sure you're rested, to take fluids, take some Tylenol or Advil if needed. Most of these symptoms should be pretty mild and people can recover and even work with those symptoms.
So another thing that I'm sorry.
One thing I would add, Melissa, to the earlier question that you asked Anne in regards to the safety of the vaccine is, I think so many times people look at the speed at which this was done as a negative. One, I look at it as a positive because it's something that can happen quickly to be able to save the number of lives that this vaccine is going to save. And also, there's been so much publicity and so much known of this vaccine and this COVID. Can you imagine the stringency in which all eyes were watching? So my belief is that this is probably as safe and safer than any other vaccine that's ever been produced, because there's more people paying attention to this than anything that's ever been developed ever, in my opinion, just because of the number of individuals that are paying attention to this.
Such a good point.
I just add to that too, because really where the scientific community is looking at this is modernizing how we're managing vaccines today. This is innovative times for us. So this is not something that's done in a hurry. It's something that's really moved us as an industry in managing vaccines very differently than we have in the past. So this is actually innovative times that the pandemic has really pushed us into.
Another thing that has come up, or a question that's come up by folks, is can they get COVID-19 from taking the vaccine, or can they somehow give it to somebody else, give the virus to somebody else if they get the vaccine?
That's another really good question. Typical vaccines that have been produced in the past are often the actual virus itself. It's attenuated, it's not live necessarily, so it's vaccine you can take in smaller doses. This is different. These two particular vaccines that are out are called mRNA vaccines. These are genetic material. And what they do is they take a small amount of protein from the virus itself, and this obviously is injected, it goes into a cell, and that protein itself is what the body reacts to. So actually you're not getting any kind of virus at all, no live virus. You can't replicate virus from this. Also, that means if you don't have the virus, you can't give it to someone either. So it also means that you will not be able to give it to someone else. So people are safe in taking the vaccine, and other people with them are not at risk from getting coronavirus from the vaccine.
So what about a senior that perhaps has had COVID-19 already? Do they still need to get the vaccine?
As this is a new virus, even though coronaviruses have been around for a long time, this is a new version of it. And so I think because we know our seniors are most at risk, the advice from the CDC and from the federal government is for seniors, even if they've had it and or anyone who had it in the past, to certainly have the vaccine. It gives you active immunity, it gives you that protection. We don't know how much protection you get from the actual having the infection itself. So this is an ounce of precaution, but certainly highly recommended that they do take the vaccine, even if they've had coronavirus.
I think so many of us are just, we're all growing weary, and our hope is that we're going to get this vaccine, and then we're going to be able to set the mask aside, and we're not going to have to worry about social distancing. Is that in fact what's going to happen? And if it is, when will that be, or do we know?
Well, I wish I could, answer that question, but the reality is we don't know. I do think this is certainly the step to move in that direction. Our stance will be that we will continue with the protocols that we currently have in place. We will continue to have caregivers in masks. We will continue to screen visitors, because the reality is we're not going to know who has taken the vaccine and who hasn't taken the vaccine from any individuals coming into our branches. So we will continue to follow the same infection control protocols that we had pre-COVID and those more stringent post-COVID protocols we put in place as well. So I do believe, though, that soon we'll be able to move into worlds where our residents will be able to participate in communal dining. They'll be able to dine once again with their friends. You know, they'll be able to have activities within our locations in a group manner, in a group setting. So this will be a way for us to more quickly move into more of a normal world than certainly if we did not have the vaccine. So I do think we'll be able to move into that in a much more quicker fashion than we would if we didn't have the vaccine.
Awesome. We are going to get these dates back up here on the screen in just a moment for folks to know, for those who are considering a move into Bickford at this time, to be able to take advantage of this vaccine. Before we get to that, though, I want to kind of close this section out with you two. Is there anything else that you want to bring out about this vaccine coming into Bickford at this time that I haven't already asked you?
Yeah, for us and for Bickford, I think the thing that I would add is that we are going to continue to really strongly encourage and get as much participation in the vaccine as we possibly can, both from our residents, from our employees, our Bickford family members. I want that for everyone in the community, because I think this is our best chance to be able to move into a world where we can eradicate COVID from our world and from our communities. So we are going to continue to strongly encourage our residents and our BFMs to participate. What's happening is we're scheduling 3 clinics. The great news is if someone should happen to miss the first clinic, they're going to be able to participate in the second clinic and then the subsequent 3rd clinic as well. So our belief and hope is that we're going to get a large participation of residents and employees in our clinics and be able to get into a situation where we have a lot of immunity within our branches. And that's my hope and desire, that we'll see that out in the community at large as well. Exciting news to hear. Anne, any final thoughts from you for this particular part of our Q&A? Yeah.
Yeah, I think that for me, it's about the numbers. We're over 20 million people infected with coronavirus, and we know the number is probably much higher. Testing wasn't in place early in the day. We know right now the pace of coronavirus is about 1.5 million people are getting coronavirus every week. We know our seniors are most vulnerable. And so for me, the game changer, the only thing that's going to affect this is clearly wearing masks and social distancing isn't doing it. Holidays have kept everyone together. So we know the only way for this to be eradicated is to take the vaccine. And so that's our strong stance. We are really strongly recommending people take the vaccine. It's a game changer for this pandemic.
Ellen, thanks for being with us. And Anne, we know that you'll stick around to answer other questions as they come up. And I know that you're watching this recording because we had a technical difficulty, but here's the thing. That form that's right there on the screen in front of you, it still works. It's a live form. It still functions. So if you have a question that comes up as we continue this presentation, we are to encourage you to please put that in, put your name, put your your question in there, hit submit, because Samantha, who you're going to meet in a minute, she is going to get all of those questions answered. So now we're going to move into, we have some previous questions that have come up on other town hall meetings, and I want to bring in everybody, if we can now, to the Zoom room. Hey there, here we are. We've got Anne. Thanks for sticking around, Anne. We also have with us Samantha Goodman. You're the one who's going to talk to everybody with their questions when they put those into the web form today. She's the director of sales for Bickford. And then we have Travis Cook. Hey, Travis, who is the divisional director of resident services for the Ohio, Pennsylvania area. Thanks you guys so much for being with us and sticking around here so that we could get some of these questions out and answered here. But again, if you have a question at home, that form down below on your screen, it's live. Just put your question in there and Samantha will get back to you. So here's some questions that I had, you guys, okay? So today is January 13th, right? It's kind of a short window on some of those deadlines that we see on the screen, which we can put back up here so folks can take a look at it. So, you know, is that even possible to be able to make a move? I mean, what has to happen in order to be able to make a move, let's say, into Bexley by January 20?
Right. So that is a short window. However, as you mentioned earlier, it's just taking possession of that apartment. And so that's just a signed agreement that you have taken possession of the apartment, which is a contract. You don't have to have all of your stuff moved in at that time, which I know can seem a little bit overwhelming to have all of your stuff moved in and, you know, potentially sell your home and all of those things. So this is just a signed contract saying that you're going to take possession of the apartment, and that way you can start slowly moving your stuff in over time, because that takes a little bit of time, and we know that. So just with the intention, you own the apartment at that time, and can slowly start moving stuff in after that.
So if somebody has to sell their house before they make a move or something like that, that is not an issue. Is that what I hear you saying?
Yep, that's correct. And so a lot of times most people are moving from a home and have to do that. And we can also help provide resources and help with moving companies. We can also help with trying to find a local realtor to do that, to help kind of take some of that burden off, because a lot of times people actually don't make that move because that in and of itself is overwhelming. So we want to help provide those resources also. So don't let that burden or that scare you into doing that. We don't want that to be the hurdle. So come take apartment possession, sign that contract, and help us be that resource for you.
And get the vaccine, which is
yes,
the
absolutely
reason for all of this. Absolutely.
Mm-hmm.
Okay, so what does it look like? Because even though, you know, folks are like, yes, I've been wanting to do this. Yes, this is the time for me to do this, or to help mom make this move. Is it something that you do virtually like we are doing today? Do they have to come into the community? How does that work?
So we would do whatever's most comfortable for the apartment possession or for the move-in. In most cases, to sign the contract, we can either do that electronically, or we can do where someone, say for example, Katie in Bexley, she could come out to the home to be able to help with that. Or we would have you come visit the branch. Of course, to get the vaccine, you would want to come into the branch, but we're able to help any way that's possible. You can do a virtual tour, or we can come out to visit you. We want to make this as seamless and as easy for you. That's our responsibility, and our job really is we want to make this seamless and easy and meet you where you're at for this. Mm-hmm. And
you know, I'm trying to get my head on, because I've been in that place with a parent or two. And I think one of the other things is, what if you don't have the apartment that I want or my mom wants? How do you handle that then?
Right.
Samantha?
Well, you know, I'm very picky, so I understand that. And so I get that, and my parents are as well. But I think that the most important thing is to try and get in right now with the vaccine. And so we would always want to accommodate and get the best fit for you at all times. But the important part is to get you in to get the vaccine. And then our internal wait list will always move faster than our external wait list. So if you can get in, then it would be our responsibility to move you as soon as possible to the best possible fit when that becomes available. And you have a better chance of getting that when you move in than you do waiting for that when you're living outside of the community of our branch.
Perfect. Okay, Samantha, I'm going to give you a rest for a minute. I'm going to go to Travis and Ann, because I think they're going to be able to answer this one a little bit better perhaps. And that is, how is Bickford handling move-ins right now? Because while this vaccine may be motivation to move in, we still have COVID-19 going on. So how is that being handled at Bickford Communities?
I think that's a great question, especially if you're coming into what we consider, Melissa, more of a protected environment, right? We're making sure that we're screening people before they come in, visitors when they come in, healthcare workers, our own staff, everyone has to screen in. So we're following those strict procedures. Obviously, we're still doing a personal protective equipment, PPE, that's our masks, our gloves and gowns and what have you. And again, these are just the guidelines we're following in relation to CDC, the FDA, but also our state guidelines and local health department guidelines. So those things will still be in play. And we know until the vaccine is fully effective, about 2 weeks after the second dose, we know that then there may be some restrictions that start to fall away from some of those requirements. But we anticipate those will be in place really for longer than that 2 week period, because we know in the community at large around our residents and where our staff and our BFMs live, there's still a tremendous amount of coronavirus today.
Yeah.
And until we get more what's considered herd immunity in the country at large, we're still at risk. So trying to manage that risk. And we do know, for example, that both vaccines are about 94% effective. We said that earlier. So there's still that 5 to 6% chance that you may certainly get coronavirus. So those protections will be in place, I believe, probably for some time. I don't know that specifically, but that would be my thought about that. Let's protect these residents for as long as we can in our very safe, protected environment.
So Travis, what would you add to that in terms of, how the communities are functioning still around COVID-19? Anything to add to that?
Yep, COVID's here and we've learned to deal with it. Our admissions have still been going smoothly for our residents and for our families. When you do move in, you will sign a consent form for the vaccine, which then I would take with and run with and get you your vaccine. And after that point, after the consent form's signed, that's all we really need. And we coordinate with Walgreens and take care of everything else so your loved one makes sure they get their vaccine.
Yeah, I loved when Ann and I and Alan were speaking earlier, and the fact that Walgreens will come to you. Nobody has to go to Walgreens. So that's also another little perk that you get by being in the community. So we get it with the vaccine, I believe. I believe those who are watching are interested because they want the vaccine. They want their loved ones to be safe inside your community. But let's set the vaccine aside for a minute, because I've had the privilege of working with you guys for a while, and Bickford's a pretty special place. So what would you say is why someone should move into Bickford in the middle of winter anyway?
Yeah, I love Bickford. My own grandmother was cared for at a Bickford, so I have a special place in my heart for it. But I think moving into Bickford at any time is wonderful, but particularly in the middle of an Ohio winter is a perfect time to move in. During a COVID year in general, with the isolation that everybody is experiencing, coming in and having a whole nother family and friends to take care of you, and the love that you're going to get, the socialization that you're going to get. Our branches are so much fun. You can go to our Facebook pages and see all the fun that we're having, not having to worry about taking care of your home, taking care of plowing the driveways, going out and getting groceries, all of those things. But the fun and love that you would get knowing that you're getting to go out and socialize is one of the big keys for me.
I think what we often see is many of us as family members, suggesting to our family members, our moms, our dads, our grandparents, of coming into a assisted living or senior living facility is very daunting. And most people tend to kind of put that off because they are just not ready to make that very, very tough decision. And so often what we see is we have many of those, what we consider very vulnerable residents, that are living in their communities that are not eating their 3 meals a day. They're not able to take care of their hygiene needs. There may be missing medications, not taking their medications, or maybe those medications drop on the floor and they can't see that. So I think the other component that we add, which is the safety component, is making sure that they are coming into an environment where we're monitoring that they are actually eating their meals, they are taking their medications. And what we find is in that first 30 days of move-ins, we see some residents flourish in this environment. So it's a safe environment to come into, but also we're keeping a very close eye on you as a new Bickford family member, resident family member coming into Bickford, and that can be a game changer for their overall health as well.
Well, I want to pause here for just a moment because, besides all those great reasons that you just mentioned, I love this brief video that Bickford of Bexley put together, and I feel like it really represents the mantra of your community, which is that the heart of a caregiver. So let's take a listen.
You're broken down and tired of living life on the merry-go-round, and you can't find a fighter, but I see it in you, so we gon' walk it out. Ooh. We gon' walk it out and move mountains. And I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I do it 1,000 times again. And I'll rise up, I like the waves. I'll rise up, in spite of the ache. I'll rise up, and I do it 1,000 times again. You, and we'll rise up, I like the waves. We'll rise up, in spite of the ache. We'll rise up, and we'll do it 1,000 times again.
Oh my gosh, that video, every time I see it, it is, whew, it gets to me for sure. And I'm assuming all of those signs were the real thing. Those were their genuine wishes, right?
I loved it.
Absolutely. I think that I've watched it several times over. It's very emotional. And the video really shows kind of throughout COVID, some of the things we were doing, like exercising. And if you noticed, there was the doorways open. You saw little feet and little knees poking out. We were exercising in the doorways. But very especially, you know, we saw how that shot was given. It's so straightforward, that it's very simple to take. But I love the storyboards. I love the ones, especially the one about I want to hug my wife. I mean, how heartbreaking is that?
And I think that you see a general theme there, right? Where everybody just wants to be around their family again and wants the community and wants to do that. I think that this year has been so incredibly hard. And I think there's a general theme that everybody just wants to get back to that. It's heartbreaking.
Go back to hugging and kissing again. That would be amazing. So, oh, that was terrific. Whoever put that together at Bexley, they get a vote from me, because that was so moving. Well, you guys, thanks so much. We want to thank those of you who have tuned in to see this presentation. Just so you know, you can click on it again and you can watch it again and again and again. That form right underneath this square, what we're all sitting in, that stays live all the time. So if a question should come up even later today, go ahead and put in your name, put in your question, hit submit. It's going to come straight to Samantha. Samantha's going to reach right back out to you. She's going to get your questions answered. And she's going to reach out to all of you who watch this video within what, the next 24, 48 hours, something like that, Sam?
Yep.
Okay.
Of course.
Well, thanks so much for attending. All of you guys, great to see you again. Thank you for all of this terrific information, and good luck everybody with your move into Bickford. I can't imagine wanting to live anyplace else. It is a terrific community. Have a great day.